today we are going to discuss blood donation. Blood is the fluid part of our body which helps in carrying oxygen throughout the body. It is made up of different components, but most of us are aware of the red part. And often when you hear that somebody needs blood, it's because you think the person needs the red part. But there is this other part, which is the yellow part we call plasma. There are other patients who also need plasma for some clinical conditions. Blood is a medicine, but it cannot be manufactured. So it takes another person to donate before the person who needs blood can have it. We always encouraging people to donate voluntarily so that in times of emergency, blood units are always available at the blood banks for patients. Some people think they would have to wait for their relatives to be in need of blood before they donate blood. But in times of emergency, waiting means dying, and we can't afford that. And that is why we encourage every person aged 17 to 60 years, whether a male or a female, to make up your mind that you will donate blood. If for any reason you can't donate, we encourage you to campaign. Some people may also be worried because they think certain things will happen to them after they donate blood. Blood donation is very safe, and we have trained staff who would take you through the process. Some people are so scared, so when they come to the blood donation site, the anxiety alone makes them feel uncomfortable. But like I said, we are really trained. We take you through a questionnaire to make sure you are in good health. We check your HB, which is your blood level, to make sure you have enough before we take from you. If you don't have enough, we don't take from you. We check your blood pressure. We check your weight, because the volume we want to take is equivalent to a certain weight. So if you weigh less than 50 kilograms, we won't bother you. We've put all these things in place so that the safety of the donor is also guaranteed, as much as we want to save patients who are not well. So you shouldn't be scared at all when you are approached to donate blood voluntarily. In fact, it is fulfilling to know that you donated your blood and it saved someone. If you donate a unit of whole blood, you can save as many as 4 lives, because I explained earlier that each unit has the red part and the yellow part. So we separate it, and then one patient who is in need of the red part, which will raise the HB level up, takes that portion, and those who are in need of the plasma portion also benefit from it. There are patients who need blood transfusion in times of emergency to improve their clinical outcome. Some of these patients are children who have suffered from severe malaria. You could have pregnant women who have delivered and are bleeding excessively. In the absence of blood, they will die. That is why you must donate. When there is road traffic accidents, people do bleed a lot. And there are situations that people go into theater for surgical procedures and they may need blood transfusion. The blood must be readily available, and so you must donate. I must also donate. If for some reason I have a health condition that I cannot donate, I will campaign. So on this day, I'm encouraging you that all blood centers across the country on daily basis accept voluntary blood donors who come in to donate for patients. People who have sickle cell disease may benefit from your blood units. Patients who are suffering from leukemia will benefit from your units of blood. Pregnant women will be alive to look after their children rather than sending them to the orphanage, and then we donate to the orphanages. And then you have a medical checkup as a way of donating blood. You get to know your blood group. Some of us, we don't even know how our BPs behave like, but in attempting to donate blood, you have a BP check. Once again, come out, join the blood centers in Ghana, Southern Zonal, Central Zonal, and then Northern Zonal. We come together, make blood available, safe blood available to all patients who need blood transfusion as part of their treatment in hospitals in Ghana, both private and then public hospitals.